Catherine Zeta Jones has checked herself into a hospital. Her publicist calls it a proactive move to take care of her mental health. The actress is going to be treated for bipolar disorder. Now, some refer to it as manic depression. It's maybe the older term. It's her second known trip to a mental health care facility. Back in 2011, she acknowledged she underwent treatment in Connecticut after her husband, Michael Douglas's battle with throat cancer. Bipolar disorder is associated with sharp mood swings, sometimes erratic behavior. TMZ, by the way, says the Oscar winner is going to go through a 30-day program, and we just found out from our medical producer that it is an inpatient program. Now, joining me now with a lot of insight into this disorder is Dr. Reef Karim, psychiatrist, founder of the Control Center in Beverly Hills, a facility that specializes in treating just what we're talking about, and a lot of other things. So first, let's talk. I read it on the National Institutes of Health website. 5.7 million Americans have this disorder. Yeah. I had no idea so many people. Yeah. Go ahead.
Well, it's a common disorder. I mean, from a mental health perspective, it's common. The biggest thing about this disorder is that when somebody has it and they go into a manic phase, it's super obvious. Super obvious you have it. When somebody's in their depressed phase, they isolate, hide out at home, and nobody knows.
Oh, wow. Now, there's a difference. She has bipolar II disorder. I've heard that that's often misdiagnosed or underdiagnosed. What's the difference in the two?
It's tricky. So bipolar disorder means you have high-end euphoria. High-end euphoria is, you don't need sleep. You talk like this all the time. You're talking really, really fast. You have racing thoughts going in and out of your head. You don't need sleep. All of this stuff happens. That's obvious to the average person. Depression is the other pole. And when you're depressed, you're sad. You don't feel like doing anything, you're not motivated, you could even be suicidal. So you get these high-end poles and high extremes. In bipolar II, you have kind of it's called hypomania. It's
which means not quite as manic, right?
Yeah, it's mania light is what I call it. And you have just as much, if not more, of the depression side. So it errs more on the depression side than the manic side.
And isn't it true that that's why bipolar II can be more dangerous? Absolutely. Isn't it there are more cases of suicide?
There's a higher chance you're going to have problems with suicidality on the depression side than you are on the manic side.
All right, so Catherine Zeta Jones, and we're kind of handling this from two sides, understanding what she's going through, but trying to apply it to those people, maybe friends or family we know.
Right.
She's going into an inpatient treatment once again. Why inpatient, and how will she be treated?
Okay, so when you're bipolar, you can lead a perfectly healthy life, perfectly normal life, but there's certain things that are triggers that can worsen your symptoms.
Okay.
Not taking your meds is probably the biggest one, but really bad stress, problems with your sleep and being sleep deprived, or drinking or drugs or any of that stuff can destabilize you and make you have more problems where you need to check in somewhere. Now, you could check in outpatient and just do a basic med check where you just change your meds around a little bit with a psychiatrist, or you can go inpatient if it's higher in severity. Or you're a celebrity and want to get away from everybody else and not be known that you're going to do it. But it's been a public announcement.
So without a doubt, the treatment involves medication. That is going to be part of it. Yeah. What's the other part? Do they do cognitive behavioral therapy?
Yeah.
Is that?
Yeah, and see, right? Cognitive behavioral therapy, sometimes herbal, like omega-3 fatty acids on top of medications, psychotherapy, individual psychotherapy, family. There's all sorts of other treatment methods, but for bipolar disorder, meds tends to be an important one.
All right. And finally, when we talk about Catherine Zeta Jones, who we're watching here, she says she's doing this proactively. As you know this disorder to be, is that more likely the case, or is it more likely that there's been a relapse?
The biggest problem with bipolar disorder is when you feel manicky or euphoric or good, your brain convinces you to not take your medications. Yeah. So the biggest problem with bipolar disorder is people that get off their medications and other people notice it and say, hey, you got to get checked out.
We have the full screen up there, everybody. We'll put that on our website as well. Just the things that you can look for, the symptoms you could either see in yourself or maybe somebody who you're close to. Yeah. Dr. Reef Karim, thanks very much for explaining it to us.
Thank you.
All right. Laura.